Welcome everyone to the Rural Healthcare Provider Transition Project, or RHPT Informational Webinar for 2022. This project was created and is funded by the Health Resources Services Administration, Federal Office of Rural Health Policy. I'm Sally Buck, the CEO at the National Rural Health Resource Center, and the center was awarded a 5-year cooperative agreement in 2020 to assist healthcare organizations in strengthening their foundation for value-based care through technical assistance over multiple years. The center is a nonprofit organization dedicated to sustaining and improving healthcare in rural communities. The center has served rural hospitals, clinics, and other providers nationwide for nearly 30 years. And collaborated with the Federal Office of Rural Health Policy for over 25 years through various rural health programs to provide technical assistance to providers and their communities. A few examples in our focus areas here at Transition to Value and Population Health. The center has served the state Medicare Rural Hospital Flexibility programs for 25 years and the Small Rural Hospital Improvement Program, or SHIP program, for nearly 2 decades. Also, we have worked with networks and technical assistance, health information technology adoption, and also in workforce with recruitment and retention. And another example added in 2020 was the Delta Region Community Health Systems Development Program, working in the southeast part of the country, strengthening needs for comprehensive TA actually in all 5 areas. Next slide, please. This is the center's diversity, equity, inclusion, and anti-racism statement. This was developed by our staff and our DEI work group in late in 2021, following a DEI assessment and training at the center. And we have 2 guiding principles that drive our work and building a culture where difference is truly valued. And through our technical assistance, you'll see that we work in a way and through our technical assistance where everyone is accepted and empowered to be their full authentic selves and everyone belongs. And we also look at how we cultivate leaders, build our programs and resources, and deliver our TA with these principles in mind. So the purpose of today's webinar is to provide small rural hospitals and clinics and state partners an opportunity to learn further details about RHPT, the eligibility requirements to participate, details regarding the application process, as well as an overview of the technical assistance that will be provided, as well as the supporting education and resources. Our RHPT team includes myself, Terry Hill, our Senior Advisor for Rural Health Policy and Leadership, Bethany Adams in Program Evaluation, Rhonda Barkus, our Program Manager, Angie LaFlamme, Program Specialist with TA, and Kiona Hermanson, Program Coordinator, who you will be hearing from through the newsletters and scheduling and resources. So Rhonda, Angie, and Kiona are the go-to people with insights that are selective. And as we noted, the program is funded by the Federal Office of Rural Health Policy within HRSA, and Janine Myers is our Program Coordinator Project Officer for RHPT, and I'll take a moment to let her introduce herself. Janine?
Sure, thanks, Sally. Good afternoon, everyone. As Sally said, I'm Janine Myers, and I am the project officer for the RHPT project. I just wanted to take a minute to thank you all so much for making the time to join us today on this webinar. We are really excited about the RHPT project, and we're also excited today for the opportunity to be able to share more details with you about the technical assistance that's available through this program. And so just welcome. And Sally, I will turn it back over to you. I know we have a lot to cover today.
Great. Thank you, Janine. And we're just thrilled to have you leading this program from the Federal Office of Rural Health Policy. Your expertise is so important as we move through applications and selection and TA and outreach. And now Rhonda Barkus will share with us an overview of RIP. Rhonda?
Yeah, thank you, Sally. As Sally had mentioned, that the purpose of RIPT is to help strengthen organizations in their foundation to really prepare for value-based care. So we're exploring areas such as efficiency, quality, patient experience, and safety of care, and a few others that I'll have the consultants sharing a little bit about in more detail in a moment. And so the goal really is to help rural health, small rural hospitals and certified rural health clinics that are not currently participating in an advanced alternative payment model of value-based care to prepare for and position their organization to be ready to participate in an advanced alternative payment model. And we do have a link here to what an advanced alternative payment model is. Basically, it's ones that are carrying more risk. We do have some of our organizations who are part of patient care center medical homes or ACOs, and that's fine. Next slide, please. And also on this slide, and as Keona said, we will be sending all of this out later, but the eligibility, there's a little more to it than this, but just some of the main pieces. So the eligible small rural hospital, for instance, would have to be defined as non-federal short-term general acute care hospital that's located in the rural areas and has 49 beds or less. And that's on the hospital's most recently filed Medicare report. Rural area is, you can see the definition there, but we do have a link below. If you're wondering if you are rural, it goes to the Rural Health Grants Eligibility Analyzer, and it identifies the areas that are considered rural. And then eligible hospitals and clinics can be for-profit or not-for-profit, including faith-based organizations. Right, next slide, please. And we do encourage you to go to the website for more details about the eligibility. So in kind of a high level of the project expectations, so as you hear from the consultants, you'll see that this is a really comprehensive consultation project. And so selected organizations must be ready, willing, and able to really undertake that consultation project. Some of the participation expectations include obtaining internal support for the project, pre-scheduling all the technical assistance meetings with us, meeting the deadlines for data requests, and then sharing successes and lessons learned. And again, the link on participation expectations goes into a lot of more detail so that you can kind of get into the weeds of some of that. Next slide, please. So here are the pieces of the technical assistance that we are describing today as far as the, if you're applying for the more intense technical assistance that involves the work with the consultants. So it includes quality focused TA from Stratis, who you will meet in just a moment, financial operational focused TA from Stroudwater Associates, who will also speak about their work. It'll include coaching to support implementation of the best practices, and then also the adoption of strategies to value-based care. And it also includes a peer-to-peer learning collaborative for the 6 organizations that are selected for the cohort. And those focus on the implementation and sustainability. And then any organization that is RIPT eligible can also attend the help webinars, whether they're selected for the TA or not. Next slide. All right, so this is the Stratis Health team. I am going to hand it over to Carrie Howard right now to tell you a little bit about her team and the technical assistance they provide.
Yeah, thanks, Rhonda. As you mentioned, my name is Carrie Howard, and I am one of the Stratis Health program managers that is very excited and pleased to be working on this project. We have currently 5 team members that work directly with the facilities: Carla, Candy, Carrie, Kathy, and Alana. And we are actually hoping to bring on another team member in the near future. And so when we talk about some of this direct technical assistance that we provide, usually what you're going to get is a pair of us in different configurations. So you'll get to know us really well during the quality project component of RHPT. Next slide, please. Just a little bit about Stratis Health. We are a nonprofit organization that is based here in Minnesota. We've been around for 50 plus years. We just celebrated our 50th anniversary within the last couple of years. And we have a long history of working to improve and support healthcare organizations to improve quality and safety. And we also have a specific focus or passion on rural health. So that is what has brought us into this partnership with the center, and we are very excited. Next slide, please. So Stratis Health, what we do within this is to provide the direct technical assistance for the quality project. And we have a couple of different ways or a couple of different tracks, I guess I should say, that we can custom tailor to your needs and desires as you are working through this project as one of the selected facilities for the intensive technical assistance. So depending on what your organizational strategic goals are, we can really tailor into one of these 4 tracks: quality improvement, patient safety, coordination of care, or patient experience and engagement. And what I will say about that is that whichever track you choose, we can kind of mix and match those things as well, because obviously these things are all very closely related. And so in the last 2 years of our technical assistance, we have done a lot of that, a lot of sharing of different tools that maybe more closely are associated with one of the other tracks, but are easily worked into your customized technical assistance design plan. Next slide, please. So here's where I just wanted to talk a little bit more about how we provide that technical assistance. We do use an organizational self-assessment. It is I think, pretty easy tool to work through that we will use as a guide, again, to help us customize that technical assistance and make sure that we are providing the tools and the resource and the education, the things that you need. Using that and other resources, we will then identify target opportunities for improvement. So from there, we'll create a technical assistance design plan that will guide our time together. And using that, you will also then create your own action plan that will span the time of our direct technical assistance and beyond. So we'll leave you with work to do as well. We'll coach you, help you work through and create and work through some SMART goals and create that work plan. And we do this with regular meetings, check-in meetings, and technical assistance coaching meetings to help you stay on track, answer any questions that you might have, provide training, tools, resources, anything that you might need to be successful. And then, of course, our favorite part is to celebrate that success, to recognize and celebrate all of your hard work. And that, I think I will say, is our favorite part, and we're just wrapping that up with this year's cohort, and it's always such a fun and rewarding time. And with that is the really quick version of what I wanted to share about Stratis Health and our technical assistance in the quality program component of that. And I will hand it back to Rhonda.
Thank you, Carrie. And Just also to know that this is the third year of the 5-year grant, and so we have already served 2 cohorts, and so each cohort goes for about a year with us, and then we do some follow-up. But in the past 2 years, because of COVID, of course, we have not been able to do any on-site. But the intention in this next year is for Stratis to be on-site some. So that's our hope, that things go as planned. All right, so with that, I'm going to hand it over to Lindsay Corcoran from Stroudwater, who will talk about the financial, operational, and readiness assessment.
Thanks, Rhonda. Welcome everyone. Thanks for joining on today's kickoff call. I'm Lindsay Corcoran. I'm a senior consultant at Stroudwater, and I have on our team that supports this technical assistance part of the grant in the program. On the financial side is Eric Schell, who's our chair and principal at Stroudwater, and Wade Gallen. He is a consultant with Stroudwater and, a rich financial background, as well as Eric as well. So a little bit about the financial risk assessment part of the technical assistance project. You'll receive an assessment done by Stroudwater, have various different components, but really just getting a better understanding about where organizations are currently from a financial and operational perspective, and what are some of the key components to making it work in a value-based payment system. And so some of the key components that we do take a look at is really around looking at your provider alignment. What's your provider strategy and provider complement within your organization? What types of alternative payments are you currently participating in, and what does that look like for you all? We also provide a population health readiness assessment. Again, really great baseline data to understand where you are on some of the key areas related to population health and making that transition. You don't have to get, a 5-rated organization, but it gives us a great kind of baseline to be able to understand where there may be some gaps, and we can help work through some of those. This year is going to be the first year that we're going to be offering and including in our technical assistance a health equity dashboard. Really important component to understanding your community and understanding where there may be some disparities within your own kind of patient population and community, and understand where, as that some of that data behind that to really help support, the health and wellness of your community members. And if you want to go to the next slide, it will we leverage what we call the transition framework. And this is a framework that Stroudwater developed to really kind of visualize what are the different areas that we should be implementing, planning for, and strategizing as we move and the payment system moves to more of a population-based payment system. So we use this framework. Framework will come up within our assessment for you all, but really we want to walk through phase 1. Where are you all as it relates to some of these key initiatives within phase 1 of this transition framework, with the goal to really understand what are the next steps to continue to move along, improving on both the delivery system and the payment system, and really maximizing efforts to be able to be successful in kind of this rapidly changing healthcare world. So, and then our next slide here is just really a visualization of what we want to try to achieve with the health equity dashboard. Again, it's taking your service area population and it's really focused on your community. So just providing some data as it relates to your population. These are the folks that you will be serving from a healthcare perspective. And it adds another layer try to understand as we think about population health and getting paid for additional activities related to population health. We got to understand the data and in our patient population a little bit better. And then the next slide I just wanted to highlight is again, this is the financial component to this. So we do need to do some financial analysis, and we look at your organization and based on, establishing a base year for your financial performance. And we layer on what that the financial impact would be if you did join, say, an accountable care organization. What would be the expenses related to that, upfront cost? And then what may be estimated based on some quality scores and some various assumptions related to your Medicare covered lives within your community, potentially, what would be some of those shared savings? And so we can look at that over a 5-year projection. And this is just a visual representation of a pro forma looking at that. Let us know if you have any questions related to this, but we're really looking forward to working with folks this year.
Right. Thank you, Lindsay. So we are really, oh, no, I'll do this first, sorry. So this is the timeline for the cohort for this year. So it kind of lays out so you can see what happens each month. We've worked really hard to not burden any organization in just one month. And so we've tried to spread it out as much as possible. So you can see that the technical assistance actually starts in December with a kickoff webinar for the cohort for the hospitals and clinics that are selected. This first row across, this is the work that we, the center do. So we do the kickoff webinar, we host and support and handle all of the scheduling with all of the technical assistance. And so the project actually goes through August of 2023 as far as the focused technical assistance. After that, though, we do follow you for another year in what we call wrap calls, which are the ways we gather information about your successes and the story of your project, what you feel good about, what your next steps are. And so we will do that at 6 and 12 months post-project. Then the next line down, you can see this is the Stroudwater work. So they actually kick off the actual technical assistance first. So in December, they would have an introductory call, one-on-one call with each organization that's selected, and would go ahead and send out the financial risk assessment and send out the data request for any data that they're needing. In January, they will be virtually facilitating interviews with some of the key leaders of your hospital or clinic in order to gather more information, that information gathering that Lindsay had talked about. In February, they review the information, the findings, the information that they have gathered as well, and will create a draft report, and that goes then to the hospital or clinic's leader. And then in March, they again have maybe it's about 4 hours. It's a really focused action planning event where they share the report. They do a readout with your leaders. You might include board providers, that kind of thing. And then from the report and the recommendations, they lead you through an exercise to decide, okay, out of all of this, what are maybe the 4 things we want to work on over the next year? And then they go through some action planning with you to create who'll do what by when. So at the end of their technical assistance, you have a very nice roadmap for the work that you're going to do regarding the FOA. And then Stratis Health, who are doing the quality work, in February, when you don't have anything with Stroudwater, they're going to be doing their introductory meetings to talk about what QI focus area you might be interested in participating in, and then they will have you do the assessment that Carrie had talked about, and they will get that back in February, and then in March they will do a 1-hour meeting with your leaders to present the project design and actually finalize the design. If they're coming on site, that might happen somewhere around March, April, somewhere in there. And then in April through August, they're really working on the implementation of your project design. And then at the very last 2 meetings in August, they actually work with you to create an action plan where you're able to look at all of the progress you've made so far and then decide again over the next year, what are you going to continue to implement? So you walk away with an action plan from Stratis as well. In the midst of that, running concurrently to this, we We'll have the Learning Collaborative, which is the peer-to-peer sharing calls. These are led by Terry Hill, Stratis, and Stroudwater, and each one is different. It's a short teaching piece followed by discussion. Sometimes there's something to go away and do and then bring back to the next Learning Collaborative. And so again, that goes from February through March, April, May, June. And then again, running at the same time will be 8 help webinars over the course of the year. And again, those are open to anyone, whether they're selected for the technical assistance or not. All right, Angie, next slide, please. Okay, so we are really lucky to have 2 of our past cohort leaders on the call today to share a little bit about their experience and their project. So Angie, I'm going to hand it over to you to do introductions. You're on mute.
How about now? No?
No, yeah, you're good. You're good.
Oh, you're good. Okay, thanks. So we're really excited to have with us today, first up, Erin Gonzalez. She is a physician assistant with the Sudan Medical Clinic in Sudan and Muleshoe, Texas. Erin and her clinic were participants of the very first RHPT cohort, and she's going to share with us today a little bit about her experience as being part of the project. So welcome, Erin.
Hi guys, thank you so much for inviting me. The RHPT project was something that was just such a huge jump for our facility. We are, so I'll tell you a little bit about who we are and about what we did through the RHPT project and how they helped us. So we are a small family-owned private practice. We have 2 locations, one in Sudan, Texas, and one in Muleshoe, Texas. So if you've ever driven through, I guarantee you've seen our clinics because we're about the only thing between you and the middle of nowhere in Texas. I am Erin Gonzalez. I'm a nurse practitioner. Lisa Allen, who you see in the picture, is my mom, and she is a PA. So she and her brother, who is our medical director, started our practice back in 2005. And then I came on board in 2019, right before the pandemic. And then we also jumped into the RHPT project. So going into that, quality-based care is one of the things that we had worked on for a really long time. Honestly, if you're providing primary care services, more likely than not, you're meeting these quality criteria and just not documenting them in a way that these advanced payment models capture. Part of the best thing that we learned during this RHPT project, especially working with our Stratis team, was how to set goals, how to measure goals, and how to work with our team, the people within both of our facilities, so that way goals could be met in a way that not only we as the leadership team wanted, but the staff wanted too, because ultimately we're not just caring for patients, we're caring for our staff's family and their friends and the members of our community, because we are so small and we are so rural. We know a lot of these people and we have since we were kids. So it becomes very personal. Stratis worked really hard with us, and one of the big things that we got was better communication as a leadership team. So it's myself, my mom, and then our administrator, Kelsey, who we actually hired after starting the RHPT project, realizing that, hey, we as the providers need to step back and really work harder in our provider role and let an administrator be our administrator. We also got to set a lot of goals for our future, which was really nice, because working with Stroudwater, they showed us that financially we do have a future, even though the pandemic was quite scary. And they'll use a reference called the shaky bridge. And if you know anything about it, or if you've read anything about it, just keep trucking on the bridge. Don't keep going backwards. You have to just keep moving. Because we realized during our assessment that we were already in the middle of the shaky bridge of transition to quality, and we needed to jump in with both feet and just keep moving. And then last but not least, the thing that was mentioned most recently, celebrating with your staff, celebrating your wins. We all kind of worked, I mean, everybody in healthcare has worked incredibly hard in the past 2 years, but we out here in rural America, where we don't have hospitals and we don't have big corporate support. It's just us and all the tools we have in our building. We really had to fight pretty hard just to get a win every day. And so we went big on our celebrations. One of our goals was that we had all of our immunizations regarding COVID vaccine reporting completed within 12 hours instead of 24. And we met that goal at 100%. We had a huge party. We bought all the staff new t-shirts. It was a big deal. And then same thing, we participated. We joined an accountable care organization, an ACO. And in joining our ACO, we set a goal that we were going to get every patient that came in that was a traditional Medicare patient was going to get a Medicare wellness exam if they were due, and they were going to have a depression screening completed in a 6-month period. We crushed it. We got 100%. Every single one of those patients had a depression screening. It was reported to Medicare and we got reimbursed for it. So it's little goals like that that are measurable and specific that help to keep your staff engaged. And so every person that we worked with in RHPT did a great job for us. We are just so grateful to have you guys.
Thank you, Erin. Next, we have Rachel Boyles, and she is the Executive Director of Service and Experience at Golden Valley Memorial Healthcare in Clinton, Missouri. And Rachel and her hospital were participants of the second cohort, or the cohort that is just finishing up. And she too is going to share a little bit about her experience with the project.
Yes. Thank you so much as well. I echo that sentiment. It was a great experience and I'm so very thankful. And I want to be honest, and I don't think our team at Stratis was aware, I was not necessarily 100% enthusiastic about participating initially. And here's why. I was handed patient experience, really handed off. We had someone exiting and it was in the midst of COVID and I was in charge of logistics for our vaccine clinics. And they said, hey, will you take this on as well? Don't stress about it too much. We'll pick it up once this pandemic subsides. So I barely had really gotten my feet wet with service, our service pillar, and then was handed off and said, we picked this as really something we've got to improve on. We're not doing well, so we need you to participate in this. So I hope Carrie and Alana and team didn't feel my resistance initially. I will tell you, think the world, we couldn't be where we are now without them. But for anyone who is somewhat maybe a little resistant and feels like it's extra work or not worth it, or you can do this on your own if someone would just give you a chance, do it. Just try to join this because it was worthwhile. Can we have that next slide, please? So we did choose patient experience, our organization did, and I want to share why. We weren't doing horribly. We weren't happy. I'm being transparent here and sharing what our top box performance was for HCAHPS. Our overall rating of care was 67%. We weren't thrilled with that. I think like a lot of organizations, during the height of COVID, we were trying to keep patients alive and keep staff safe, and a positive patient experience for those folks meant that they got to be discharged home. We really lost sight of how do we help patients have a great experience while they're with us. So we took this opportunity to really take a very close look at our inpatient performance. We did choose inpatient. We have opportunities in so many of our patient experience areas. We did choose inpatient because we had a CNO who was very engaged and supportive. And we had inpatient nursing leaders who also, specifically our med-surg ICU, that were hungry for feedback on how to improve. Maybe didn't feel like they had the bandwidth themselves to come up with the ideas. So we're very open to, please somebody lead us, tell us, prioritize things for us, and we'll implement. So our goal was to increase our overall rating for our inpatient baseline, for our inpatient overall rating of care to 69%. We can go ahead and go to the next slide. I tried to sum up a few things we implemented, knowing that short time for presentations. One of the things that I really wanted to do was to develop an organizational patient experience plan. It was strategy, and then aligned and coincided with our organizational strategic plan. I had scope creep struggles, I started and restarted several plans. And with Stratis and their action plan focus, it finally helped me hone in. Here's what we really need to do. They gave us a wonderful template, really helped me identify what needed to be on there. And so we now have an org-wide, it's organized based on service lines essentially. So we have an inpatient, outpatient, ED, and clinics section on our org plan that demonstrates here action steps we're taking and how it aligns with each of our strategic objectives, as well as who is responsible. And I present an admin team quarterly with where we are in meeting those key actions. So it's really helped all of admin team to be on the same page and understand where we're at and how they can help with accountability and moving the needle along. And I mentioned we collaborated really closely with our nurse leadership. We had so many things. Our nurse leader said, we don't even know where to start, Rachel. It's just, we have a lot of things we need to fix. So again, working with Carrie and Alana, we really looked at what will give us, we want to know what will give us the biggest bang for our buck right out of the gate. They have a beautiful auditing tool. I'm not sure, I don't recall, Carrie can speak to this, if they, based on our plea for help, if they created it on the fly or if they already had it. It's a thing of beauty. And I was hoping I could show it, but I didn't know how to, it's a multi-sheet tool, so I didn't know how I could get it on the slide. But the wonderful thing with that is it has a crosswalk. So we could see, based on our HCAHPS domains, what are key must-have behaviors that will impact those domains. Amazingly helpful filtering, so we could really focus on, okay, we can't do it all, not just yet, what do we want to focus on? So purposeful rounding, thank you, Carrie. See, they just implement, they create and implement things on the fly. They're amazing people. So we focus on purposeful rounding. We wanted to make sure our bedside shift reports with our whiteboards and our hourly rounding were meaningful and that we were doing a really great job checking for the important things from a quality and safety standpoint, but just making the patients know that we're there, we're happy to be there for them, and they're in a good place, a safe place they're going to do well with. So that was our focus. It took us a little while to wrap our arms around that, so we haven't done as many validations as we had hoped right out of the gate to test the tool, but we have started that. And just as was previously mentioned, Carrie and Alana really had us focus on celebrating the small steps. Don't just wait for your 90-day goal to be met or your annual goal to be met. If you've got a small goal, celebrate the heck out of that with your team. If we can go to the next slide, I'll tell you a little bit about what we did. You may have noticed on the previous slide, sorry about that, that we had a pretty significant increase. We, in one quarter, thank you, in one quarter working very closely with the coaching, we went from 67%, our goal was 69%, to almost 80%. This was our inpatients, and that included, again, medical, surgical, ICU, and birthing center, our overall top box. This was huge for us. And to, while we know it's one data point and we want to be able to sustain that, historically, we would have said, well, that's so great. Can't celebrate until we make sure we've got at least 3 data points. So it's a trend. Again, encourage, don't wait, celebrate. So we did, our CNO had an idea to have a Lucky 13 party and included not just nursing team members, but also all of the other areas that assisted pulmonary, EVS, therapy services, all of the folks who make an impact on patients every single day and work shoulder to shoulder with our nursing team. Sorry, now I promise the next slide will be great. So we want to continue with this momentum. I mentioned that I'll be providing quarterly updates on our patient experience strategic plan with our admin team. I'm also really trying to take ownership of our service pillar. So we're starting small. I'm working with our patient care services, really our nurse nursing leaders in all of our inpatient and ED settings to get together to create 90-day goals and action steps so that our CNO and our directors, as well as myself, are really in alignment. We're looking and focusing on the same things, auditing the same things, so that we can improve the intensity of our focus and make some more measurable continued goals with our purposeful rounding. We also identified that we could really benefit from having some type of patient experience personnel directly working with our nursing units. I imagine as many of you all are, we're in a similar boat in which our nursing leaders, often they're directors, but they're often hopping in and maybe they're taking teams themselves because we still have COVID. We still have people out with COVID here. So sometimes it's not always feasible for them to be always that person or people to do the audits and do the just-in-time coaching. So we are going to start. We anticipate starting that position next month, in which we will have, it's a nurse. It happens to be a nurse who also taught CNA program for years. So a lot of education experience. We're really lucky for that, but she will be part of the bedside shift report process, and she will evaluate whiteboards, and she will assess and be in there for hourly rounding and using support coach support. We'll definitely do it in private, but provide feedback, positive, and then some coaching opportunities to our nurses so that we can be better for our patients. We also are being very strategic in having skills labs so that we are not just expecting our folks to know right out of the gate what they're doing, but we want to give hands-on training and validation opportunities with those items. And my focus for third quarter, which starts for us in October, is to take the best practices we learned from Stratis and applied for our inpatient teams, and now use the same tools, same processes for our ED. And that's our plan. That sums up our next quarter anyway, and look forward to implementing more best practices soon. And that's all I've got. Thank you.
Thanks so much, Rachel and Aaron. It was really just a true pleasure working with both of you and your teams during your time with the project. Thanks for being here today and sharing your experience. Moving on, there is some additional technical assistance offered through the RHPT project. It's a 4-part RHPT learning collaborative, and this is open to applicants who are not selected as one of the 6 in this next cohort. Those applicants will be given first priority to participate in this peer-to-peer learning collaborative. There'll be a total of 20 hospitals and clinics that will be selected to receive this virtual TA to promote knowledge base and support readiness for future focused on-site and virtual technical assistance through the project. We also offer the health education and health webinars to all RHPT eligible organizations. We'll be hosting 8 webinars this coming year, and registration, descriptions, past recordings of these health webinars can be found on the RHPT website. So as Rhonda mentioned earlier, we do hold recommendation adoption progress calls. These are conducted with organizational leadership at both 6 and 12 months post-project to support the RHPT follow-up process. And the purpose of these RAP calls, we call them RAP calls for short, is to assess the extent a RHPT small rural hospital or certified rural health clinic has adopted consultant recommendations and best practices, and also transition strategies. The 12-month post-project call will also include post-project measurable outcomes. And it's also a time for us to celebrate successes and to provide any additional technical assistance and resources to participants during these calls. So we have had RAP calls with our first cohort, the cohort that Aaron was a part of. And some of the early outcomes from the very first RHPT cohort was under financial and operational improvements was there had been some expanded telehealth, lower readmissions, capitalizing on coding, improved cost reports, improved HCAPS, and also improved accounts receivable balances. And some of the early quality outcomes around the areas of efficiency, quality, safety, and patient experience include some improved care coordination, improved patient satisfaction. There were new and expanded EHRs, improved patient discharge processes, focused population health planning, and also establishing school clinics with telehealth kiosks. We also wanted to share some feedback from the first RHPT cohort. This was pulled from the end of the project evaluation assessment, and the RHPT technical assistance overall satisfaction got a score of 4.6 out of 5. The first cohort scored a 4.6 on whether or not they would recommend the RHPT project to others. 4.8 of the cohort felt more prepared for value-based care due to their participation in the RHPT project. The selected learning collaborative overall satisfaction was a 4.8 out of 5. And the help webinars being useful to prepare the organizations to be effective participants in a health system focused on value, and that rated a 4.4. So we received really strong feedback from that first cohort on their participation, the technical assistance from having participated in the project. I'm now going to turn things over to Rhonda, and she'll talk a little bit more about our application timeline.
All right, thanks, Angie. And I will say also that the feedback assessments that we do, we use the feedback that we're getting to improve year after year. So we really listen and have made some changes based on feedback that we receive. So the application for this next cohort is open and has been. It's a rolling application, so it's always open. It's really simple. We've simplified it this year. It takes less than 10 minutes to complete. The deadline for submitting the application would be by just right before midnight, Friday, September 30th. And then applicants are notified of whether or not they're selected late October, early November 2022. And then the real focused work, starting with Stroudwater, begins in 2023, although you saw that there are a few things that will happen in December of 2022. Next slide. So just some thoughts about how you might think about applying. Any of these 4 options are fine. So a small rural hospital and their clinics can apply together. And so they can all receive that service as one big group. Small rural hospital can apply alone. A certified rural health clinic can apply alone, or a consortium of certified rural health clinics can apply together. And that's part of the application that asks you how you're planning to apply. Next one. So this is what the application review and selection looks like. So all the applications are first reviewed by the center, which is our team. And then we schedule a 60-minute phone interview with your hospital or clinic leadership, where we dig down a little bit more into what are you already doing around population health? Do you have a strategic plan? What does your quality program look like? And the questions for the phone interview are on the website, so you know exactly what we're going to ask in advance. When Kiona schedules this, she also includes it in the Outlook invitation so that you can be as prepared as possible. Based on the interview then, there's an overall recommendation that's made concerning the likelihood of benefiting from RHPT focused TA. And so we identify as strongly recommend with barriers, or do not recommend. Upon completion of these interviews, then we do review it with the rest of our leadership team. We then present it to Janine Myers, our PO, to get final approval. And then once the final approval is given, then we go ahead and reach out to the 6 organizations that were selected for the upcoming year. Next slide. So just a few reminders about timelines. Friday, September 30th by 11:59 p.m. Go ahead and apply or send in your application. September and October, the 20-minute interview calls are held. We're already doing those. So those are in process. Late October, early November, we let the organizations know who's selected. Mid-November, the selected organizations will be announced in our newsletter. And then the kickoff webinar for the 6th in the cohort will be held Tuesday, December 6th. So we do encourage interested applicants to just hold that on their calendar just in case, because I know that schedules fill up pretty quickly. And then in January, the TA actually begins. And next slide. Yeah, so the last thing then is just to see if anybody has any questions. Please feel free to unmute if you have questions for anybody at all. That would be fine. Or please put your questions in the chat box as well.
Hi, can you guys hear me?
Yes.
I have a question. So this is just giving us guidance on how to prepare to participate in an ACO or an alternate payment model. It's not actually signing us up to join one.
Correct.
So my organization is looking at joining an ACO, but we're not currently in one. And they've actually started reaching out to certain models. We're a critical access hospital and we have rural provider-based rural health clinics. So that's why I just want to make sure we're not committed to signing into an ACO if we're already looking at joining another one.
Yes, no, absolutely. Yeah. This is not tied to a certain ACO or anything. It's really just to prepare you both quality wise and then financially to be able to be successful in an ACO.
So this might be something we really want to look into then.
You might, because it would certainly help position you to be stronger participants in an ACO. And we do have some folks who have been in the 2 cohorts who already are part of an ACO, or like Aaron from Sudan, they had already joined an ACO when they were with us, but this helped them to be better or stronger participants. And the other thing is there were some that said, yes, we're already looking at it and we want to use this as a stepping stone. There are others that are still kind of learning a little bit more about what this all means.
And then would we want to apply as the critical access hospital or as one of the rural health clinics or as one of each?
That's totally up to you. If you want to use this as an opportunity to improve quality and look at financial around for the hospital and clinic or clinics together, you could apply together. If you wanted to apply with just one way or the other, you can do that too.
Okay,
so you're not required to apply in any certain way, regardless of whether you have clinics or you're a critical access hospital.
All right, thanks.
Yeah, thanks for the question.
I have a question in the chat box. And Lindsay, maybe you can help us identify this and just give a quick synopsis of what does the financial risk assessment identify?
That's a great question. For the purposes, we look at operations. I think would be the best bet, where we look at both down that transition framework, that phase 1 of the transition framework, where we're looking at what is the relationship with your providers? Are you operating efficiently? What is your quality and your quality infrastructure look like? In operations, when we look at operating efficiently, we're looking at kind of what's your historical financial position been over the last 4 years. What are you doing to maximize revenue cycle performance to really kind of set the ground on being financially efficient and stable to be able to enter into some of these alternative payment models? What are you doing in your clinics as it relates to care management? Things like that. The financial, and then we'll do the financial risk assessment, where we look at, based on a bunch of assumptions, what would be kind of the upside downside revenue to you in terms of in the form of shared savings in a potential ACO. Hope that helps.
Thank you.
Any other questions? So Angie, if you'll just show the next slide with our contact information, as Sally said, you're welcome to reach out to any of us. If you have more questions, we're happy to do email with you or talk by phone or Zoom. The recording will be going out to you along with the PowerPoint presentation, so you'll have the access to all of the links that we have shared. And I think that is it. Sally, is there anything else before we wrap up?
No, it's just, going to again remind folks to take some time to review the application. Part 1 is very straightforward, and then part 2 on the interview gives you a chance to ask questions, as well as our team, to just make sure there's a good match there in terms of readiness on the project. So don't feel you have to get a screenshot or write down all the contact information, because Kiona will follow up with all of you with slides, recording, and more contact information. And we just we encourage you to consider application. We really look forward to filling all the slots this year and working with new clinics and hospitals in RHPT. Thank you all, and have a great day.
Thanks everybody for coming. Thanks to our speakers as well.